Hello, everyone, and welcome to episode 188 of the Citrix Session. I am your host, Bill Sutton, the Director of Modern Workspace at XenTegra. I have a member of the team here, Randy Price. Randy, you want to say hello and introduce yourself and tell everyone about you?
Sure. Hey, everyone, Randy Price. I'm a solutions architect that reports to Bill, part of the Modern Workspace team, focusing on EUC solutions. Um, like I said last time, a lot of experience in Citrix, been using it for 20 plus years at this point. So good to be here.
Yeah, but Randy he always sells himself short. He's got a lot of expertise in other EUC vendors, as well as a lot of the ecosystem, like ControlUp and Liquidware and things like that. So today, on the topic for today is a blog article published September 30th. It's entitled One Tap, Zero Complexity, Why Healthcare IT Leaders Are Embracing Unicon plus Imprivata. It's written by Philip Benkler. Philip is the former CEO of Unicon and is now a senior director or VP, I believe, at Citrix over that business, the Unicon business unit. So for those of you who aren't familiar with what Unicon is, I think probably, Randy, it might be a good idea to give a quick primer on what Unicon is and who's entitled to it. So Unicon as an organization has been around about 30 years or so or more. And they have the Unicon ELUX, that's ELUX OS, which is an endpoint operating system that when they were acquired back in January of 2025 by Citrix, they had deployed it to more than 2.5 million endpoints across multiple countries, including a couple of large-scale financial services customers with 300,000 plus endpoint devices. So I had not heard of them before this acquisition, but they're definitely not a startup. Been around for a long time and have a lot of presence in organizations around the world. Many of those organizations are running Citrix on the back end and leveraging the Unicon ELUX OS to access the Citrix environment, but it obviously works with other environments as well. Randy, any other thoughts there? You want to maybe talk a little bit more about the architecture, the management concepts and that sort of thing?
Sure. To your point, right, ELUX is the thin OS operating system. From a management capability, it's centralized management. The solution's called Scout. So Scout Enterprise. And from that perspective, there's really two ways to manage it. They've got a Windows application you can use. However, everything's sort of transitioning over to what they call Scout Board, which is their web-based management console. There's a SQL component from a database perspective. However, you just know that there is the capability, right, from a management perspective to not only manage both internal devices as well as external through what they call their Scout Cloud Gateway, which is basically an appliance that you deploy in your DMZ to allow remote management of external devices. So they really got it kind of covered both from an internal versus external use case, regardless of when those endpoints reside, and having the capability to manage those from a centralized location, right? So, and that includes configuration, right? Support, the ability to mirror those devices from a troubleshooting perspective. Okay. So it's
how do you lay down an image, Randy?
So they have a solution. So within that, right, there's a solution called Elias. Elias is their image, I'll call it their image management, right, solution, in the sense that you'll go and download a collection of packages from today it's myunicon.com, right? But you'll go out, you'll download those packages. You'll pick what applications that you want installed on your image, and you'll generate that image, right? So when you click an application, let's say you want Citrix Workspace app, you'll actually pull Citrix Workspace app over in Elias into an image that you're creating, tell it to solve. It'll go grab all the dependencies and create that image for you. And then within Scout Board, you can assign that image to the endpoints that you want to utilize it. Gives you full configuration as well, so you can go in from a device and application management perspective to configure in all of the things that you would typically configure for Citrix Workspace app, redirection of USB devices, authentication, which I think we're talking about here specifically with the Imprivata integration. All of that is configurable within Scout Board as well.
Yep. So like Randy alluded to just then, we are talking today about the integration of Imprivata into the Unicon platform. So really where this comes down to is a lot of healthcare organizations leverage Citrix virtual apps and desktops, Citrix DAS, and Imprivata to enable easy and quick access to the environments for clinicians. Obviously, CDAD and DAS deliver a really solid experience for clinicians, with Imprivata handling single sign-on and multi-factor authentication. So like Randy alluded to, the Imprivata is an authentication provider that enables what's often referred to in healthcare, and I've seen this myself, as tap and go. A healthcare provider walks up to a device, they tap their badge, typically the badge that they use to get into through the building access system. Not always, but in many cases, the same badge. They'll tap that onto a card reader of some sort. There's also other ways to do it. They can use proximity and things of that nature. But they tap into it, and immediately logs them into the environment and presents their clinical application, their EHR, their electronic health record application. And then they start, taking notes and delivering care to patients. And then when they're done, they basically tap and walk away. And it essentially creates a disconnected session in Citrix parlance that's sitting there waiting for the next time they click the card on another device, in which case it comes right back. There are some organizations that still rely on the old approach of entering a username and password. And obviously, that's most hospital organizations, healthcare organizations want to try to improve patient care and reduce the amount of time you spend accessing systems and spend more of that time on patient care. So Unicon with Imprivata helps this. So it's not really a technical issue. It's really more of a true business problem, because again, you don't want your clinicians spending all the time trying to access the systems and work within the systems. You want to make that as efficient as possible so that they can get in and out quickly and move on to the next patient. Any thoughts around that, Randy, at this point?
No, I was going to say, you're exactly right. That's typically, one of the first statement in this blog post, right, says, seconds matter, and in healthcare they truly do, right? So, we were talking about patient care. There's different, varying factors here at play, but in reality, seconds do matter in some extreme cases, right? We're talking about life and death. So having the capability to log in very quickly, get what you need access to. And that's been some of the challenges that I think that a lot of healthcare organizations have expressed is, long login times, having to remember multiple passwords, especially as we start adding password complexity as well, right? So having the capability to have something that I possess, being able to go up, tap, log in very quickly, like you said, log out, and just focus more on patient care than having to focus on, some of these more technical aspects really helps improve, not only from a clinician standpoint, but also the patient experience as well. So.
Exactly. Yeah. So one of the ways that Unicon improves healthcare is obviously leveraging the Unicon ELUX OS. Gosh, excuse me. The Unicon ELUX OS means that there's less footprint on the endpoint. It's a pretty thinned down Linux-based operating system that runs on the endpoint. But one of the key things is if you are a current Citrix customer with the right licensing, which is pretty much anybody that's renewed within the past 2 years, a year and a half now, you own it. You own it. If you have universal hybrid multi-cloud or the Citrix Platform license, then you own licenses for ELUX and Scout or Scout board. So the endpoint operating system and the management framework. So it's available to customers. Really, what you really need is to get the Imprivata licensing if you don't already have it, and get that laid into the ELUX OS. Obviously, this is pretty straightforward and something that we at XenTegra can help you with. But there's nothing additional is needed. Nothing new. You have to obviously acquire the Imprivata licenses, but there's no new licensing required on ELUX or anything along those lines to enable access to Imprivata running on ELUX. So by consolidating the endpoint with Unicon, you gain a number of things along with Imprivata. Like Randy was talking about, accelerated clinician access. So we mentioned tap and go and fast user. We'll talk about the next couple of topics there, Randy. Strong security and operational simplicity.
Yeah, I'll just say, right. So again, to that point, if you're a Citrix customer, you have this entitlement. And so, especially in healthcare, right, having the capability to, reduce the number of of different vendors that you're having to, support in that sense, right? To where we're not having these siloed vendors that you have based upon the different stacks, having the solution that's provided in the end that you're getting from Citrix in this sort of use case, both the endpoint as well as the virtual apps or desktops that you're providing, having that one model where if there is an issue, right, you can call that vendor and have support from a support perspective.
Right.
But again, the strong security aspect, it's a thin client OS, right? So it's a hardened Linux read-only OS that you're delivering from a security perspective. It helps as far as delivering things like security updates and keeping those updated. Using a traditional Windows endpoint, that's always been the challenge, keeping up with the Microsoft patches and the other apps that are running there, right? And then we have, AV and malware and all these other sort of solutions that are running on that. Having a thin client read-only OS that we're delivering down with just the apps we need, and then the security policies in play as well around that, what the user can and can't do, what we're going to redirect into the session, right? All those sort of things from a USB perspective. It just helps, strengthen that security posture. And also, again, just helping from an operational perspective, just helping to streamline because we've got less vendors at play, simplified support, less on the device itself that we're having to support as well. Again, just trying to provide that clinician with an easier experience as they're looking to support the end users there or the customers at this point. So.
Yeah, and another thing is obviously when you think about it, if you've got your Citrix environment, whether it's on-prem or Citrix DAS, and the Unicon operating system is owned by Citrix and delivered by Citrix, and it's used to deliver Citrix, then you've got really alignment with the overall story. So you've got one vendor that's covering it from the endpoint all the way up to the application tier. Now, yes, you may layer in other things like Imprivata, which help support some of the security and accessibility features. But at the end of the day, when you start looking at ELUX in particular, Citrix owns it end to end. So any changes made on the endpoint operating system would be incorporated into CDAD or DAS or vice versa, much more quickly than they might be within another environment. Another key thing is cost efficiency. There's no additional licensing fees. As long as you have UHMC, Universal Hybrid Multi-Cloud, or the Citrix Platform License, we refer to that a lot, it's CPL, then you own the licenses for Unicon for your entire environment, which helps reduce the total cost of ownership. So if you're currently running Windows-based devices, then you can very easily implement Unicon in place. You can essentially run an image wizard on that device and lay down the Unicon OS either in parallel to the Windows OS or a replacement of the Windows OS. There's other ways to deploy it. A USB device, I believe Pixie can be leveraged to deploy the OS and so forth. So this approach obviously provides real value to these organizations, enhancing patient care and outcomes, just like Randy and I were talking about. So it allows them to be more effective. And again, like I said earlier, really focusing on patient care rather than accessing the system. So there is a lot more detail. If you visit the blog article online, there's a lot more detail about integrating Imprivata Unicon. There's a whole technical article. Go to the blog post, which will be referenced in the show notes for this podcast, and click on the technical documentation link, and you can see a lot more detail about the integration. Any final thoughts, Randy? That's really the end of the blog article, so this is a pretty quick one today.
Yeah,
any final thoughts?
Yeah, I was just going to say, we kind of hit on a couple things, right? One, the Unicon acquisition, the entitlement. Specifically today, we talked about the Imprivata integration, but specifically around healthcare and how it can help both from a clinician satisfaction or more timely patient care, right? But not just from the Imprivata standpoint with healthcare, but also just utilizing Unicon in general, right? So definitely
Right.
see an uptick in customers that are looking to evaluate Unicon, especially since to that point, right, the cost efficiency that you mentioned, because it is included with their entitlement. So I guess a call to action would be if you're interested and you have, again, if you're utilizing Citrix today, which I assume if you're listening to this podcast, most likely you are, definitely recommend reaching out. We could definitely help you guys if you guys want to, look at it, look at a POC, evaluate it. We can definitely help in that regard. So,
Yeah, Randy's already done at least one POC that I know of. And I think we've all built it in our labs, and it works pretty well. Certainly does what it says it's going to do. And this is just another example of the Imprivata integration, is another example of Citrix working to expand the capabilities of the solutions that they own and have purchased. So just another commitment they have to see moving things forward, I guess, and providing value for customers. Because at the end of the day, when you think about it, you're paying a lot for the Citrix licenses. There's a lot you get, and this is one of those things among many others like Uber Agent or Device Trust. And here at XenTegra, we've learned all of them and are capable and ready and able to help customers understand what's available to them and get it in a POC or a pilot phase to help start to kick the tires. So that's it for today's podcast. Thanks, Randy, for joining and riding along with me and providing some good content. I appreciate it, and I guess we'll see everyone next week, or talk to everyone next week.
yeah, thanks for having me, Bill. And we'll see you guys next week.
See ya.
Thanks.